Good afternoon, Philip Marcus. I am Mihiraa. Let's start the warm-up session. What is the dignity of being a doctor?
The dignity of being a doctor stems from the profound trust patients place in their caregivers during times of vulnerability. It involves upholding ethical principles such as beneficence, non-maleficence, and respect for patient autonomy. Doctors have the privilege of making a positive impact on individual lives and contributing to the betterment of society through their expertise and compassion. The profession is characterized by a commitment to serving others with integrity, empathy, and professionalism. Ultimately, the dignity of being a doctor lies in the profound responsibility to promote health, alleviate suffering, and preserve human dignity.
What are the skills I need to be a doctor?
To become a doctor, you need strong foundational knowledge in medical sciences such as anatomy, physiology, and pathology. Proficiency in clinical skills like history taking, physical examination, and diagnostic reasoning is essential. Effective communication skills are crucial for building rapport with patients and collaborating with healthcare teams. Problem-solving abilities are necessary for diagnosing medical conditions and developing treatment plans. Finally, empathy, compassion, and professionalism are indispensable qualities for providing patient-centered care and navigating ethical challenges.
How would you deliver bad news to a patient or their family members?
Delivering bad news to a patient or their family members requires sensitivity and compassion. Firstly, I would ensure a private and comfortable setting, allowing for an open and honest conversation. I would begin by expressing empathy and acknowledging the emotional difficulty of the situation. Using clear and simple language, I would deliver the news directly and allow ample time for the patient or family to process and ask questions. Finally, I would offer support resources and reassurance, emphasizing that they are not alone and that we will work together to navigate the challenges ahead.
How do you communicate with patients effectively as a doctor?
To communicate effectively with patients, doctors should prioritize active listening, empathy, and clear language. Establishing rapport and trust by demonstrating genuine care and respect is crucial. Using plain language and avoiding medical jargon helps ensure patients understand their diagnosis and treatment options. Encouraging questions and addressing concerns promptly fosters a collaborative relationship. Follow-up communication ensures patients feel supported and informed throughout their healthcare experience.
Describe your ability to handle high-pressure situations.
My ability to handle high-pressure situations as a doctor is grounded in experience, preparation, and resilience. I remain calm and focused and make quick, informed decisions, prioritizing tasks and ensuring clear communication for efficient teamwork. Additionally, I prioritize self-care to recharge amidst demanding circumstances. I view high-pressure situations as opportunities to showcase my skills and dedication to patient care, adapting effectively to ensure the best possible outcomes.
Your preparation time is over. You can now start your roleplay.
Mihiraa, I can see you're in quite a bit of pain right now, and I want to assure you that we're going to figure this out together. It must have been really difficult getting through practice today, especially with how severe the pain seems to be. Why don't you tell me a bit more about what happened?
Thanks, doctor. Yeah, it started suddenly during practice. I was just running, and then out of nowhere, this really sharp pain hit me right in the front of my left knee. We put an ice pack on it, and my coach drove me here. It's swelling up a lot now, and I can't really walk or put any weight on it without it hurting a lot.
That sounds quite concerning, Mihiraa. Have you had any pain like this before? Maybe something similar or less severe.
Well, I've had some pain in my knee over the last few days, especially when I'm running or playing. But I thought it was just growing pains or something because I don't remember injuring myself. My knee's been making these clicking or popping sounds too, and sometimes it locks up, but I didn't think much of it.
It's good that you mentioned those symptoms. Based on what you're describing, I suspect you might have a meniscus tear, Mihiraa. The meniscus is a piece of cartilage in your knee that acts as a cushion between your thigh bone and shin bone. When it tears, it can cause the kind of pain, swelling, and instability you're experiencing. The clicking and locking of your knee are also classic signs of this kind of injury.
A meniscus tear? That sounds serious. What if I just take it easy? Maybe if I rest it for a bit, I'll be fine by the weekend.
I'm afraid it's not just about resting for a few days, Mihiraa. To recover properly, you'll need to follow what we call the PHRASAL regimen: rest, ice, compression, elevation, and referral to a physiotherapist. This will help reduce the swelling and manage the pain, but most importantly, it'll protect your knee from further injury. The physiotherapist will create a specific exercise plan to help strengthen the muscles around your knee and support the healing process. Ignoring this advice could lead to long-term issues with your knee, which could jeopardize your ability to play not just this weekend, but in the future as well.
Can't you just fix my knee so I can go back to playing? I'm young and fit, so I'm sure I'll recover quickly. Maybe you could give me some painkillers and a spray to numb it?
I understand how important this competition is to you, Mihiraa, and I can see how determined you are to get back on the court. However, treating a meniscus tear isn't something we can rush, especially if you want to ensure a full recovery. Pain medication and a numbing spray might help temporarily, but they won't address the underlying injury. If you play on a torn meniscus, it could lead to more damage, possibly even requiring surgery, which would keep you out of the game for a much longer time.
Then give me a solution. What is the quick fix, doctor?
Mihiraa, I understand how frustrating the situation must be for you, especially when you're so eager to get back to playing. I'm referring you to a physiotherapist because they are experts in helping athletes like yourself recover from injuries like this. The physiotherapist will work with you to develop a tailored exercise plan that focuses on strengthening the muscles around your knee, which will support the healing process and help prevent future injuries. They'll also guide you through specific treatments and recovery strategies designed to reduce pain and swelling, improve your knee stability, and restore your full range of motion. This isn't just about treating the current injury. It's about ensuring that when you do return to the court, you're in the best possible condition to play safely and effectively. Working with a physiotherapist will give you the best chance of a full and speedy recovery, so you can get back to doing what you love without risking further damage to your knee.
I see. But doctor, I really want to play this weekend. It's important for me personally and also for the team.
I completely understand how important this game is for you, Mihiraa, both for yourself and for your team. It's clear that you're dedicated and passionate about your sport, which is commendable. However, I want to emphasize that playing this weekend could cause serious harm to your knee. If you play on a torn meniscus, the injury could worsen significantly. You could end up with a more severe tear, which might not heal properly without surgery. This could lead to chronic pain, ongoing instability in your knee, and a much longer recovery time, potentially months off the court, or even permanent damage that could affect your ability to play basketball in the future. Taking the time to heal now will give you the best chance of a full recovery, so you can come back stronger and continue playing at your best. I know it's a difficult decision, but your long-term health and ability to play sports in the future depend on it.
Oh no, I can't risk my career. I don't want to make things worse. I guess if this is what I need to do to get better, I'll follow your advice.
I know it's a tough decision, but you're making the right choice for your long-term health and your sports career. Let's focus on getting you back to 100%, so when you do return to the game, you'll be stronger than ever. We'll start with a RICER regimen, and I'll refer you to a physiotherapist who can guide you through the recovery process.
Okay, thanks, doctor. I'll do what I need to do.
You're welcome, Mihiraa. We'll get you through this, and soon enough, you'll be back on the court. Take care of yourself, and let's stay in touch about your progress.